As we age, the disc goes through a natural maturation and degenerative process. This is in part due to simple aging and part due to the wear and tear that goes on in our lives. Here we're looking at a disc that is early in its degenerative phase. What has happened is that there are fissures or cracks developing in the outer part of the ligamentous disc annulus, the solid part that holds the pieces together. Now this is quite early on and is difficult to detect by any of our imaging systems. Magnetic resonance imaging, which is a specialized technique for looking at the discs, can demonstrate early degeneration, and I call your attention to this image. We're looking at a spine from the side. The vertebral bodies are the large gray squares. The discs are these bright white wafers. You can see that this one is different. It is much darker than the adjacent levels. As the disc degenerates, it becomes darker on an MRI scan because it's losing some of its water content. What this would look like in a model would be this particular specimen. As you can see, there's no longer any central nucleus and separate annulus, but rather a dried, cracked, fissured disc. When this process happens, the normal disc height, which keeps these openings large enough for the nerves, is lost and the disc collapses. You can see the distinct loss of height between the two. As the disc collapses, the spaces get smaller as they're squeezed together, and bone ridges, spurs, or osteophytes develop along the margins, and these further add to the material, making the space small, putting pressure on or compressing the small nerves that pass through to the components in the lower body. The degenerative cascade from the normal to the degenerative disc occurs in all patients or all subjects throughout our life. But there can be specific events which are different from that normal degenerative cascade. When these little fissures develop in the outside part of the disc then becomes vulnerable to other injury. In the case of a subject bending and twisting and lifting, receiving a direct blow to the back, slipping and falling, landing on the buttocks, any variety of traumas can cause these little curvilinear fissures to communicate with the nucleus by way of a single radial or linear tear or fissure. When this happens, the pressure in the central part of the disc can now push material through this crack into the outermost part of the disc annulus. This causes the outside or annulus to protrude or bulge slightly. This in itself can be a cause of back pain because this outer membrane is sensitive and contains a number of nerves which let you know this membrane is being stretched. And this produces back pain which can be minor, the backache we all experience periodically, or it can become quite severe. In the most advanced stage of this process, the disc can actually rupture and material from the depth of the disc extrude out into the canal, as you can see here, putting pressure on these sensitive nerves that are immediately adjacent to the disc rupture. When disc herniation occurs, disc material extends out of its normal space toward the nerves which extend to the lower extremity. In this model, we see the red disc herniation extending into the space occupied by this yellow nerve. When there is pressure put on the nerve, specific symptoms occur. These include altered sensations such as numbness or tingling or a burning sensation, and can be severe lancinating pain which extends down the full length of the extremity. Here we see an MRI scan of a patient who has sciatica. This patient has had severe leg pain for about 4 to 5 weeks. The pain extends from the buttock down the back of the leg and calf to the undersurface of the foot. On this side, the S1 nerve, which is this vertical dark band, is pushed backward by this gray mass of tissue. This mass is a disc herniation or protrusion which has come out of the disc space, extended backward, and is now pressing against and displacing this sensitive nerve and causing the symptom of sciatica. The lumbar discs are in the front of the spine. There are moving parts in the back, the paired facet joints. These are small joints between the vertebra, here and here, which allow gliding and flexion extension movements in the spine. These joints have a capsule which surrounds the bony elements. The capsule is sensitive and if it is stretched can hurt. These are joints about the same size as the joints in your finger, and you can imagine if you stress or twist the joint to a certain position, it will cause pain. These joints are subject to considerable motion and wear and tear as a result of that motion. When that wear and tear becomes excessive, we get changes as demonstrated in this model. The disc space is narrowed. There are reactive ridges forming at the bone margins. The joint is also degenerating. The combination of these two degenerative processes, narrowing of the space, results in narrowing of this root canal or foramen, bringing the bone edges closer to the nerve, and finally causing back pain, occasionally leg pain by irritating the nerves in front of the joints. When we put the degenerative process together, if the disc space narrows and the joints become irregular and overgrown, the two combine to cause narrowing of the spinal canal, which occurs generally in older age and is often associated with severe back pain because of the small size of the canal. Procedures which make the canal larger take the pressure off of the nerve and may be helpful in eliminating these symptoms.
Thank you again for your interest in the VAX-D therapy. We hope you call today and make an appointment with one of our network physicians. You'll be glad you did.